Okay, we'll call the meeting to order. The reason we're having this meeting is to discuss the Governor's Executive Order 20-68. That was written last Wednesday after our meeting. If we would not have had a meeting till Wednesday, this goes into effect at 12:01 a.m. on Wednesday morning, and we wouldn't have a chance to discuss it or do anything about it, so that is why we're here to discuss that executive order. I would open it up to public comments at this time for 3 minutes. Yes, sir.
Yes, my name is George Sanders, and went on the internet, and Stafford County's had 177 total cases and 1 death. Since last week, today's date, 23rd, we've had an increase of 18.7%. I saw in the news that the hospitals around the Stafford area are getting full or filled with virus cases and other cases, and that they are getting to the point where they don't know what they can take. If they're in a bad car wreck, that's a question. The average age of the people in Stafford County is 44. Not that we're really old, but we're not really spring chickens anymore. I would like to use the governor's mandate this as a kind of antidote. We have a law that says that you can't go over 70, 75 miles an hour on our highways. And this keeps people from going 120, 150, whatever they can do. And to me, the reason for that is the safety of our citizenship. And this virus is not a political statement. It is a disease, and I think that we need to approach it as this, as a disease. I appreciate your time, and thank you for having a special meeting today.
Thank you. Any other comments?
I will. I'm Dr. Jim Doran, for all of you who don't know me. K-State, DVM. I've been out 50 years. I spent many years in the military as a public health veterinarian, doing epidemiology and disease contact tracing, etc. before I came here. I hate these damn masks. They fog my glasses. Intubation is also not very good. My son's an anesthesiologist. They're seeing people that have been intubated for 6 to 8 weeks. They're coming out with multiple diseases afterwards and extensive therapy. This virus is one of the most highly contagious viruses that we know. It's almost as contagious as measles, or equally so. It's spread, what makes it extremely dangerous, it's spread by asymptomatic carriers. That is people that exhibit absolutely no symptoms at all, and 55% of the cases we get are from asymptomatic carriers. Of those carriers, less than half of them will ever develop any kind of disease at all. Wearing a mask prevents me or anybody else that's asymptomatic from spreading it to his neighbor. You do not have a right of free speech to yell fire in a crowded movie theater. With public health, you also do not have a right to infect the rest of the population. Herd immunity. To get to herd immunity, you have to have 75% of the population either vaccinated or have been exposed and recovered from the disease. That's 2,700 people in Stafford County. 2.7 million in Kansas, 270 million nationwide. We have a vaccine out. It's an RNA messenger vaccine. It's probably going to be fairly effective, but it requires 90 degrees below zero temperature to make it stable. If we're going to vaccinate people, we have to have logistics in place, the finances in place, which I know hasn't been directed anywhere nationally, statewide, or in the county. That's going to be a logistic nightmare. What's happening in our local hospitals, my wife works healthcare, they've got 15 to 20% of their healthcare workers out today. The hospitals in which she works, their beds are full. We need to flatten the curve. We're not going to flatten the curve any other way other than preventing its transmission. University of Kansas does one thing other than playing basketball. They've got a pretty good medical school. Half the counties that have a mask mandate have 50% of the transmission rate as those counties that do not. KU Med. Children in school, they have a pretty good natural immunity. Little snot-nosed little brats have a jillion coronaviruses that they're already exposed to. Up until about their adolescence, they maintain a pretty good immunity. I'm not an advocate of closing schools, closing businesses, or anything else. They have a pretty natural immunity. When you get to be my age, be 74 this month, I don't have a very good immune system. I'm disease-free. I'd like to stay that way. I think if you look at pre-existing conditions, diabetes, heart disease, overweight, and age, that probably affects 75 to 80% of the people in this county. Fritz and I are rapidly approaching that age or creeping over it. It's airborne. That's microparticles in the air that spread, and they're now looking at 12 feet, 6 to 12 feet transmission rates, or in circulating air in a room. Glasses, I don't like wearing them, but they protect us because our mucous membranes absorb the virus. Cranial nerves, it only affects your taste and smell. Those cranial nerves go from your sensory area to your brain. They're finding now from postmortem exam, it's not at the tip of your nose that's affected, but it's actually in your brain. So 2 of your 12 cranial nerves, not a bad deal. Be careless. Any questions?
I thank you.
Did I use my full 2 minutes, David?
I might ask you one thing, Jim.
Sure.
Were you aware that we've had a mask mandate since August 19th here?
Well, it's not highly enforced, is it?
Is any of them going to be enforced?
I don't know that you can enforce it. You can enforce it within your own, the people you employ. I don't want some cop coming up to my window, because I get a lot of high-speed driving awards. I don't want some cop coming up to my window and saying, give me your license. No, put your fucking mask on first.
I just want people to be aware that,
Can you enforce
we voted
it?
on this on August 19th, and we haven't rescinded it or changed it.
You can enforce it with your own employees. We're pretty careful with my employees, because I have an employee's spouse who has some pre-existing clotting diseases. We do not want to bring this disease home to her, and we're very careful.
I hope I didn't use up my 3 minutes. I do have heart disease and diabetes, and I am overweight. And these, like the doctor said, are people that are of higher risk to contract this disease or virus. And I asked the commission to not opt out of the mandate that the governor has suggested.
Phil,
There's
do
some,
you have the guys down there at the county when they're around people wear masks?
Yeah, if they're in the break room, they got the mask. If they're in the, and we can't social distance with the trucks, I mean, most of the guys are by themselves, but the ones that are in the trucks.
Yeah.
I asked them, I said, if you're comfortable, you do what you need to do, but
Yeah. Anita, you guys, if you have people in the office, you guys wear your mask, right? Is that the way it is with the county, with the Register of Deeds office? You
What's
have
that?
people in the office, you guys wear masks?
We don't wear them when we're sitting at our desk because we're pretty far apart. If we get up to go to the counter, we put them on, or if we have to go back to the vault to help somebody, we put them on. If we're in close contact, we definitely put them on. Now, you know, like I said, at our desk, we're like from Bryce to here.
Yeah.
Sorry, I can't, this is fogging my glasses up.
Yeah.
I'm not, I don't like to wear the mask either. Frankly, I don't have to wear a mask right now because I've had it and recovered. But I'm doing it because there's a sign on the door of the courthouse that says you need to wear a mask. I agree with the decision in August with the mask mandate. Now here I'm stepping out of a question here. But I'm going to tell you what's happened to me. I exposed many people unknowingly. I started coughing on a Monday. I thought it was allergies this time of year, I get them. And I went to yoga that night, but I did take my temperature before I went to yoga, and it was fine. Went to yoga, exposed 5 more ladies, and 2 of them got it. Each of them gave that to their husbands. One of their husbands is in a hospital in Nebraska right now because they could not find a bed in Kansas, a cardiac COVID bed, and he is not doing very well. And I have a ton of guilt. And so I would like to see you not opt out, because I don't think I'm the only story like that.
I also have a comment prepared too, if that's all right.
Hold on just a second.
Okay.
So I think the courthouse, all the officers are wearing their mask. Both banks that I've been to, the employees wear their mask.
I know one of the banks isn't wearing a mask because I deposited a check there today.
Is that American State Bank or St. John National?
Well, you can throw a rock from the courthouse to the bank.
The last time I was in there, they were all wearing masks and had their,
There was one person in there wearing a mask. I drove by, deposited a check through the outside deposit. No, you can't enforce it except for your own employees, the city employees.
I think a lot of the stuff that you're saying needs to go on is already going on. When I go to White's, all the employees are wearing masks.
No, they're not.
No, they're not. This is not wearing a mask.
No.
This is not wearing a mask. Covering your mouth and nose is wearing a mask.
Now, some people would say leaving your mask loose on the bottom isn't wearing a mask.
No, that could be, but you know, I used to be able to tie these behind my neck. In my old age, I can't get my shoulders back where I can tie them behind my back of my neck anymore. You know, there's CDC guidelines, communicable disease control, KDHE guidelines, and science. Whatever you do, I'm a scientist. You know, I got 240, 50 hours of science college credit plus 20 hours a year for the last 50 years. Follow the science. The science is not that hard. This is evolving. This disease, this virus did not even knowingly exist outside of a bat population until late December or early January of this year. I have a classmate who's a world-class virologist that's had it in his lab in Texas as soon as it became available from his associates in China. Long time before it ever made the popular news. We're just learning about it, you know, and what we know today will change tomorrow. But everything we're learning is dynamic. So wearing a mask is the simplest and easiest thing we can do, and any public area should have a mask mandate.
We got one.
Yeah. But it's not forced. And I don't know how you do it except by
Tell us
example.
how you enforce it. We need solutions,
I
not just
think,
statements.
and I didn't even intend to speak, so sorry. I think the community gets that you can't enforce it. You can't stop people in the street and this and say, put your mask on. I think what they want is to see that you guys, as leaders of our community, care enough to opt in, is what I think.
Have you read the executive order?
I have not, honestly, but
Okay.
I think from what I'm seeing on Facebook, they want you to be proactive.
You know, look at the
Can I
city
read?
law enforcement.
Yeah, you
that
can
don't
read
wear
it. And
masks.
I'm not, like I said, I didn't even intend to speak, but.
Hold on. I want to just read you a paragraph. Also effective at 12:01 a.m. on Wednesday, November 25th, 2020, all businesses or organizations in Kansas must require all employees, all customers, all visitors, all members, or members of the public to wear a face covering when they're in there.
I don't have a problem with that.
How you gonna enforce it?
Well,
I yell at my guys to put
it's
their
their
masks on.
business, so.
We ask people at the health department to please wear a mask, and if they don't have one, we provide them with one. And we do have cloth ones that they can take and reuse.
I'm all for, coming in, if anybody asks me to wear
We're
a
not
mask, I
rude about
wear
it, but we just let them know that we would prefer that they wear a mask because we're wearing one to provide services to them and that we need to be at work, and if they bring it into us, we can't be there.
I agree.
So,
I think we gotta wear
The
masks.
health department's a little bit different than like White Street Liner, that have quite a few people come in a day. I'm sure you guys are busy in there, but I mean, it's a little bit different.
Shannon, would you agree that, I guess, following the science in our Executive Order 20-68, our resolution, a person should wear a mask when a person for a period of 10 minutes or longer is unable to maintain a 6-foot distance from other non-household individuals? Is that, in your opinion, following the science?
He's reading from that.
yes, because if you're standing there talking, you can watch people's droplets come out of their mouth, and that's how this is passed. It's through airborne droplets. So if you're standing there talking to somebody and you're within 3 feet of them and you talk with them for 15 or 20 minutes, you're inhaling everything that they're blowing out.
Yes.
And that's what this virus is airborne.
So to me, that sounds good to you.
Yes.
This is.
Okay. This is the Stafford County's motivation to Kansas Executive Order 20-68. So this is what we've had since August.
This is one that we're.
No, this is new.
This is
new.
This is
Yeah.
one addressing 20-68.
Okay. But in your opinion,
So this one
this
is not on water.
10 minutes or longer, unable to
Well, I don't know.
maintain a 6-foot distance,
Totally off.
non-household individuals, that's following the science.
How does that change from the governor's?
No, this is something I think
Well,
quickly.
I'm trying to, I've read them both several times, and I'm not an attorney. A lot of it's attorney lingo, but, other than absolute, what Kurt's reading, if I have a business, if I own Harder Auto, or if I own a place of business, I personally would not like somebody to tell me how my business is being ran. But Stafford County's motivation to Executive Order 20-68 would say that a person should wear a mask for a period of 10 minutes or longer, unable to maintain 6-foot distance. So,
Is that one that you put together and made?
Yes. I combined two from 2 other counties that I got this morning. This is basically what Thomas County did with a few
Okay.
modifications. from
think-
Ottawa counties.
But other than having a few more ways that people can opt out of not wearing a mask, I mean, this is primarily the order that we've had in place.
Well, yeah, but this addresses 20-60,
Yeah.
which is what you've got to do now.
Okay.
The old order that we've had up to now said, maintain a 6-foot social distance in public areas and masks are required in public areas, period. No matter how close you are. That's what's been in effect since August the 19th. Yes.
The question I've got is, it was my understanding that the resolution that you folks were going to pass or deny was opting in or out of the governor's mandate. Is that right or wrong?
That'd be correct.
So if you opt out of it, then the masks are gone?
No,
No,
we're gonna do our own. We've been doing our own since August.
We'll opt out with what the state says, but then we'll come up with a resolution that would best fit.
And that's what I was reading from this.
That's what, yeah.
Well, it's very similar to what we've had in effect since August.
To me, it's respect to our fellow human beings to wear a mask.
I don't think we disagree with that, and that's why it's in there.
May I question why, when you are not scientists and not medically trained, you would want to opt out of the state's order, which is from KDHE? The physician that heads KDHE is very knowledgeable, well-spoken. Why you would go against CDC guidelines? I go into one of these businesses that we're talking about just about every day that I don't know that you'll ever get them to. But it's a public health hazard, I can tell you that from my 50 years of experience doing public health and epidemiology. I don't like going in there. And if there was a place that I could go that had a mask mandate that gave me the same service, I would change suppliers.
So do you think, I mean, you can paint broad brush, I mean, it should be the same as in Kansas City, Topeka, Wichita, as what it needs to be in Seward, Kansas, and Turkey, Kansas?
I believe you wore a pair of pants in here today because it's
I
a
didn't
state
know what you
order.
said, Jim.
I said, I believe you wore a pair of pants in here today because it's a state order.
But do you think there's more close contact in Kansas City and Wichita than Chancery?
I don't wear one outside. I don't wear one when I'm out in the wind or in the sunshine.
I guess my point is I have a problem with just doing one mandate for the whole state. You drop for the worst situation and nobody else should be able to do anything on their own.
Jim, could I read you one part of the executive order to see if you agree with it?
Okay?
In the exceptions to wearing a mask, it said, persons engaged in an activity or event held or managed by the Kansas legislature is exempt. Do you agree with that one? You think it might be political?
Now, a scientist can
You think it might be political?
Only a politician or a lawyer could come up with that out.
That's what she put in her order, Jim. It's
Well, and
political.
you can cherry pick anything you want,
She
Kurt.
could come up with one of these every day, you know it? And we'd have to come in here every day and act on it.
I
It is
just,
political.
from an epidemiological standpoint, and I know these other businesses that we all know are probably not going to enforce the mandate, but if we set an example as leaders of this community and our law enforcement, our county government, our first responders, our hospitals, follow the order, other people will follow, and we will flatten out the curve. That's what we really need to do, is flatten the curve, stop the exponential rate of this virus growing until we can get a vaccine that we can deliver to 70% of our population, or we have a herd immunity. But until you get to herd immunity, you're not going to be playing basketball in the schools, you're not going to be doing the other thing. So you've got to get the herd immunity first.
Can I add to that? We've got somebody here in the county now that has tested positive twice. So
Yeah,
herd immunity
exactly.
isn't a guarantee at this point because after a 3-month time span, your antibodies run low and you can get it again.
Is there any chance that one of those was a false positive? No chance?
They were PCR tested both times.
Because my sister,
Well-
Hutch, got tested positive, and then they said
One was an
they...
antigen. And it's got a failure rate.
I know a couple that you know very well, mother and daughter, both had the same symptoms, both had the long swab, and one of them tested positive, one of them negative, and the daughter had worse symptoms than the mother had. I mean, they're not perfect, they're good.
They're not, I'm not saying that they're perfect, but I am saying herd immunity is a long shot at this point. They're still working on things to be able to even have it be herd immunity.
You know, you keep talking about herd immunity, and you gotta get to 70 or 75%. For the disease to start decreasing, you hear about T-cell immunity. Individuals already have some immunity to it. I read where up to 60% of people have T-cell immunity to it.
Say again, Todd.
60% of people may have T-cell immunity to it.
I don't think any solid science indicates that. There's garbage science that indicates that, but I don't think there's any solid science that indicates that. Children, you know, coronaviruses have limited cross immunity. But, you know, the common cold, one of the coronavirus, rhinovirus, Fritz can name more of them than I can. We have coronaviruses in livestock, dogs and cats. They sometimes affect the respiratory system, sometimes the digestive system, but their immunity largely is short-lived. Children who get constant exposures, little snotty-nosed little brats, they've got a pretty good immunity till they're adolescents. But, you know, once we get to my age, our immunity level drops and we don't develop very good antibodies.
Jim, I agree with almost everything you said. We're concerned about it. We're trying to find a solution. We've had mandates in place that most people don't realize all along. Maybe they haven't been enforced, but I don't know how to enforce them. But we are going to try to do the best we can to make it better.
I think you start with your own employees, law enforcement, first responders, hospitals, there, and then you go to the rest of the community. But it has to stop. You have to be the leaders.
Do you guys wear masks when you make traffic stops? Your guys?
Most times they do. I mean, there's always the time they get out and initiate the stop and forget to do it, but you're right, yeah, they try to, yes.
If I could interject, unless you're willing to enforce it, you can pass whatever you want to pass. So until you get to that point, I mean, you could give this gentleman everything that he wants. And I wouldn't stand over here and argue with you about it, him about it. I would not. But unless you're going to enforce it, it doesn't matter. At the end of the day, unless you're going to enforce it and do something about it, and that again comes down to, you know, Rob and his agency is the one who would write the tickets, and I would prosecute the cases. But, you know, if I'm going to be getting a phone call from one of you all saying, you know, we don't want this to happen, then it's kind of a mood issue, to be somewhat candid with you. And I'm just being completely blunt. But that's kind of who and what I am, and a lot of people don't like me because of it, but that's all right. I'm just telling you, unless you're willing to do something about it, you can come up with all the language in the world. You know, there's really nothing in here that has any teeth to it. There's not a whole lot Shannon can do about it. There's not a lot that Dr. Farmer can do about it. And there's not a lot that the sheriff can do about it, or I can do about it. So until we're ready to actually...
I don't disagree with you, but how I see it is if you leave the governor's orders in place, you're saying we're going to follow the science. You're not going to enforce it. Rob's not going to be out writing tickets. Some of our local businesses aren't going to enforce it. But if you leave it in place like it is, you say you're following the science, there's people that know more about this than we do, and just go from there. I know you're not going to enforce it, just because it's not truly enforceable.
Well,
That's something you don't enforce.
our health nurse would like to say something. Can she speak for you?
This morning, I went and got some statistics just to provide for everybody to kind of know what's going on. This month, for Stafford County, our positivity rate has been 19.3%. We currently have 2 active clusters in Stafford County. Our current case rate is 42.59% per 1,000, and I got that this morning, and it's changed. We've been in the red zone for Stafford County since October 18. We've not come out of the red zone of new cases that we're getting daily. Overall, the entire state of Kansas is in the red zone with only a few age groups that are in the orange range, which would be ages 0 to 4, 18 to 24, and 85 and older. And then directly from the CDC website, they promote mask use to stop the spread of COVID to other people, even if you don't feel sick. The mask is meant to protect other people in case you are infected. Everyone should wear a mask in public settings when around people you don't live with in your household, especially when others' social distancing measures are not able to be maintained. Masks should not be placed on young children under the age of 2 because they can't remove that from themselves. And you should keep about 6 feet between yourself and others. The mask is not a substitute for social distancing. I believe a mask mandate would help our community. It's been proven that masks are effective in reducing transmission of communicable diseases. Surgeons wear masks to protect you during your procedure. If you're hospitalized with a respiratory illness, your nurse wears a mask to protect themselves and their other patients. When you go to the dentist, the hygienist and the dentist wear a mask to protect themselves. When you go to the doctor with flu-like symptoms, you're asked to wear a mask whenever you come to the office to protect the physician and their staff. At this point, our healthcare systems are overloaded, hospitals are filling up, and we haven't even reached peak influenza season. Early on in the pandemic, we were asked to flatten the curve. Everyone banded together, and we were able to achieve that. Now it seems there is a huge me mentality happening, and we're not looking out for one another. Wearing a mask is the way to help protect your family and friends. It doesn't have to be about COVID at this point. We should wear a mask to help the hospital workers that are exhausted. Wear a mask to help keep more people out of the hospitals. If the hospitals are full, where will the patients that are having a heart attack or stroke go? Where will EMS transport patients that require hospital care after a car accident? If they're full of COVID, there's no place for those other things that are happening to go. Pratt and Reno County have put mask mandates into effect. I know that Sedgwick County is enforcing it. I know that it's difficult to enforce. This shouldn't be about politics, it's about the science. And I know that there are people in our county that want to follow a mandate because they've called and asked us if there's one in place, and we've let them know that the one from August is still in place.
Okay. Yeah, we've got one. All right.
It's not a mandate or a guideline.
It's a mandate.
And also, I gave everybody, all the commissioners, one of these printouts. I got this emailed to me on Saturday, and this is from
We're listening to a lot.
the state of Kansas checking wastewater in Stafford. And it's showing that we actually have probably more positives than we even know about based off of the levels that they got in the wastewater in Stafford. Just Stafford, not Stafford County, just Stafford.
Do any of the science things say anything about what kind of mask you're wearing?
If it's 2-ply or higher, it should be blocking droplets.
Okay.
So 2 layers of cotton mask should be effective.
Just as good as an N95 right now.
An N95 is hospital grade. That's what we've used to test people. And if you are wearing that along with a face shield, it's protecting all of your mucous membranes, so it's the highest level possible.
Would you, if we pass the guideline, would you recommend that people look for an N95 if they really want to be safe?
A 2-ply, no, a 2-ply mask like this or a 2-ply cotton mask would be effective. I don't think that everybody needs to be walking around with an N95 on, and especially whenever our healthcare systems are overloaded, that's what the healthcare systems need, because that's what they need to be wearing to protect their staff, because they're running low on staff even because of how full the hospitals are getting.
I'd like to ask the attorney, what would it take to enforce a mandate?
About 5 times the officers that we currently have,
No, I
or
think
maybe
we're,
10 times the officers we have.
no, I mean, when you're out on duty and you see someone that is, say, I was in the post office in Stafford. I had a girl come in to the lobby area, not 6 feet from me, not wearing a mask. I asked her where her mask is. Oh, I've got one. Now, to me, that should have been enforceable.
I don't disagree, but I'm asking you.
And I am saying,
when-
don't go out, when the first speed limit went into effect, I mean, did we have the same attitude? That, oh, our officers are going to be overloaded with all of these cases? I mean, use your common sense as to what you should do. It's just like if I'm going 3 miles an hour over the speed limit, it's your decision whether or not you should pull me over or let me go. I mean, use some common sense.
Oh, sure.
That's all I've got.
It's not common anymore.
Okay, I think,
I would like to say something.
Commissioner Grimmett.
I'm in favor of masks, and in the very beginning, and even 40 years ago when I worked in the OR, I was in favor of masks, because masks stops infection. But there's something that came to my mind about enforcement. You go to a restaurant or a grocery store and it says no shirt, no shoes, no service. How is that enforced? Is there something on the books that if someone walks into, say, a grocery store with no shirt, no shoes on, can they be arrested and prosecuted?
No,
All right.
they can be advised that you're not welcome here,
So
and if you come back here,
It's up to the business.
it's
put
up to
another bullet on there and say no mask?
That's the businesses that do that, no shirt, no shoes, no service.
But who started it?
Dollar General has a sign on their door that says not to come in without a mask on. And I literally was there yesterday in my vehicle, getting ready to go in and watched 3 people walk in without one. And I've had staff check me out without one on. And I've gotten comments made at me because of where I work that are snarky because people don't have them on whenever they meet me in an aisle. Which I don't really appreciate, but I don't say anything and I go about my business. I just don't understand why, like, all I want is people just to stop and think of somebody else for a minute. Like, I know we can't really enforce it, but come on. This isn't a joke.
How do the other 2 counties, like Pratt and Reno? I know Pratt has an enforcement, like one sentence, that these are enforceable by law.
Well, you can
What do
say
they do
that.
in Reno? Because Reno's the big one.
Right, Mike? You can say that, it's not important.
Yeah, you can say it, but at least there's some teeth. I mean, what you have does not.
Because 50% of the counties around here are in a lockdown mandated mask condition, and here we are in the middle, so to speak.
If we could have that bullet point in there, it would be beneficial because we get tattled to about people that are supposed to be in quarantine because they are a direct contact and they could be really potentially spreading it and they're not staying home and they're not wearing a mask. And it really shouldn't be enforceable, at least for that situation.
Say that again, Shannon, I forgot.
We have had people call our office and say, we know this person's supposed to be in quarantine and they're out and about and they're not wearing a mask. And our office gives quarantine orders.
Wouldn't that be enforceable though?
It should.
Yeah, the sheriff delivered the order.
They enforced it in Great Bend. They had a habitual offender that was out and about all the time. They actually picked him up and fined him as a pretty substantial fine, but he had been picked up multiply and taken home. And that's why I was wondering if this, Reno County's got to have some way of enforcing it. You know, they put it on the books that way, and it says that, you know, fines can be leveled, and that's the way Pratt's, but I just read Pratt's at 8 o'clock this morning, because I didn't know it had happened, where they enforce a mandate, and they say fines are capable or something like that, in that very last line. I'm not the attorney, and I know he don't want to do it, and I don't blame him. He didn't want to get a shot over a mask.
Well, the Pratt website says that the sheriff has said that he wasn't going to enforce it.
Well, I don't know, that's,
Yeah, I don't know either.
I don't know, I'm just saying, there, it says there's fines available or whatever available. You know, it's a finable incident, but what do you do, put it onto your taxes, or what do you do?
Yeah, I have no idea.
I'd like to see some kind of enforcement, and I don't mean the sheriff's department or the city departments to go out and just wholesale people that are not wearing a mask. I mean, use the common sense. And like I say, I would like to see some kind of enforcement or some kind of guidelines that have maybe a little teeth in them.
How do you do that?
I agree.
Have an escalating,
I think we'll use this from the governor as a guideline, but we'll come up with our own, and we'll pass a resolution in effect.
What would happen if we went under the governor's guidelines right now and then go ahead and start developing a Stafford County mandate or law, suggestion, whatever you want to call it?
We'll have something to vote on by Friday, or by Wednesday, which will be 2
Okay.
days.
And what we
We've
have
had
now
one
will not be
all
out of
along.
that.
Pardon?
What we have now is not gonna, regardless of your guys' decision right now, what we have in place right now from months ago
Yeah.
isn't going to change.
No, not until we change it.
Yes.
So we do have a mask mandate in order now.
Okay.
And if White's or Dollar General wanted to say you gotta wear a mask, and if you don't wear a mask, you can't come in, they can enforce
Yeah.
that.
Yeah.
But I mean, it's not gonna be the sheriff's department's responsibility.
Yeah.
If White says leave and they won't leave, then they'll call Ron. But it's up to them. Any business can do that right now.
Yeah, something that I found interesting, I ventured into Reno County at Lowe's, and I had a complaint with the service there, and I asked for the manager. And I looked up, and there were 5 people within 3 feet of one another at Lowe's and Hutchinson that had no mask on. Right at the front door, it says mask required. So I called the corporate offices, and my suggestion was you have the opportunity to keep your doors open and your company enforce the mask mandate, or they can just close you down, a lockdown. Now, to me, mom and pops I think they deal with a clientele possibly that they would respect you saying you've got to have a mask on. But when Lowe's has 5 people in there at checkout line, it just, I couldn't believe it. So that was another experience of mine.
I think we'll close the public comments now, and the meeting will be conducted by public employees. If the public elected employees have a comment, that would be fine. Do you have anything else?
We are to the point now with this that it is community spread. There are people that we contact that tested positive, and we go through the interview questions and the contact tracing with them, and they can't tell us where they got it. So it's highly important that our community takes this seriously and that they go ahead and wear masks out and about. Because like Luann said, we're to that point that you don't think you have anything going on, and you go and do your regular everyday things, and you're in contact with 10 people, and then 3 days later you feel sick. All those people you were around are potentially going to get sick now. And then if somebody doesn't have the immune system to fight it, it's a problem. And with the hospitals being so full, it's just really concerning, because if anybody needs that care, it's going to be really hard to get it.
What do we have today, 174?
Whenever I checked before I came at
Total
1:30, we're at 178.
Of the
Total
178, how many have been hospitalized?
We've had 5 hospitalized. We currently have 1 hospitalized right now.
All right.
I'll add something, since you said elected officials could speak. Yeah, that sounds like a low number that is hospitalized right now compared to what active that we've had. But it doesn't just affect the person that is sick. There's a trickle-down effect. I had to get additional care for my parents. I mean, my dad, he can do whatever, but, you know, I had to arrange meals and things for my mom because I couldn't be around her. I caused my daughter not to be able to go to work for 2 weeks. That affected all of the other employees in her office. It affected my employee in my office. She couldn't work. It's not just about you. You got to think down the line about it, and I hope everybody does. I mean, honestly, I was being very careful because of my mother, and I wanted to go see my grandbaby. So I thought I was being super careful up in those 2 weeks before my trip down to see the baby. Don't know where I got it at all. I thought I was wearing my mask. Hand sanitizer in the car. You just don't know.
You're right, it affects a lot of other people.
Any more comments? I'll make a motion that we opt out of the executive order 20-68.
Second. We have a motion and a second to opt out of the Governor Order 20-68. Any more discussion amongst the board?
We will work on a resolution.
Yeah.
By Wednesday.
Yeah.
They have something by Wednesday.
Is that part of your motion?
Pardon?
Is that part of your motion then?
No, I think that was just information.
Just by itself?
Yeah.
Okay, we have a motion and a second. All in favor, say aye.
Aye.
Motion carried 3-0. We are planning on working on coming up with, like we've had, something that's good, workable. If I'm looking for solutions, I'm not looking, I mean, we've heard the political talk for 9 months. I want something, if somebody says, we ought to enforce it, show me how. You know, I'm tired of just hearing the same thing over and over again.
Is get people to buy into this.
But how do we do that?
You don't, and that's just it. So, you know what I do? I don't talk to them. I go away from them.
Well,
That's what I do.
If people ask me,
If you won't wear a mask and you want to be in public, don't bother me, because I'm not going to talk to you.
And I mean, that's how I've
And I
taken
hate to
it
be that way, but I have no choice.
with the
Well,
sarcastic
but-
comments that
but
I've
that
gotten
is
in
my
public
choice.
But my
places, that's how I
comment,
go
is
about
my
it.
comment to Phil, and
No,
I'm not disagreeing with Phil, I'm just saying, it starts from the top down.
And
And if
it's,
the public sees that you're not doing it,
it does.
they're not gonna do it.
So when I'm in an enclosed area to the south of Sur, and I don't have an option to bag out of there, what's our solution?
I don't
I
know.
don't,
You don't have
she
one.
could have had the virus and given it to me, but no one cares.
I mean, you're right, and that's the whole problem.
That's
Quit going to because I can go to Pratt, and we have a mass mandate.
Council member for your time.
Okay. David, we're adjourning.